Hello. Happy Monday to you. Good morning, good afternoon, good evening, wherever you're dialing in from across the world. My name is Margot Goodson. I am Vice President, Head of North America Diversity Inclusion at SAP. We'd like to thank you for joining us for this annual commemorative event recognizing World AIDS Day, honoring the people living with it and remembering those lost to disease. It also celebrates our 5-year commitment and partnership between IBM and SAP's Working Positively campaign to end the stigma in the workplace associated with HIV/AIDS. For your convenience today, we do have closed captioning and ASL available, and you can activate that from your end. And just to give you a little history about it, over the 5 years, we've certainly done quite a bit across the globe. And it was first launched, the Working Positively Initiative, in Germany in June 2019 as a result of the partnership between SAP, IBM, and Dusha Age Life. It is expanded to various regions, which you'll see and hear about, and various NGOs, including Human Rights Campaign, Center of Disease Control and Prevention, the Red Cross, Fundación Huésped, and Trabajando en Positivo, among others. We have over 400 companies now who have signed a pledge to ensure that we end the stigma against HIV/AIDS in the workplace and other chronic conditions. Truly, there are so many times where the workplace has to be accommodating, and your culture of inclusion and respect for our colleagues who live positively with chronic illnesses. And so the number of companies who have taken the pledge has grown, and we're super proud of that because it makes a difference to your workforce diversity and your workplace inclusion as to how you embrace your colleagues and as well as your benefits and healthcare needs, both physical and psychological and emotionally, right? And so we're just hopeful that as we continue to spread awareness and grow this campaign, that we'll get some more signers. Through the years, here are some of the things that we've done. We've had annual World AIDS Day workshops and presentations and panel discussions like you're joining us today. We've had some signer events live from different parts of the globe. We've done in-person and online panel discussions, awareness campaigns, and we've even had ambassadors launch. I have to give tribute to Axel Wetler. He's not with us today, but he certainly has gone across the globe and been the ambassador and the face of the program for all 5 years. And we too at SAP have even engaged some of our colleagues to help out in some of the locations that you see here in the United States, Germany, Argentina, Mexico, Bulgaria, South Africa, UK, Philippines, Hungary, and the list goes on and on. It's important that we ensure that not only are we spreading awareness and education, but that we're activating those who are here to support the cause and grow the advocacy around the globe for one another. Whether it's this aspect of inclusion or another, we want to ensure that we are intentional in our efforts. And with yesterday being World AIDS Day today, we're glad that you took the time to be with us today to discuss this and learn of ways for you to engage personally or professionally within your companies. So we're going to dive into a panel discussion, and you will see here that we have a chock full of representation on the next slide of our speakers that will share their stories, respond to inquiries, and engage with us on here. You have the ability to submit questions through the chat or the Q&A, and we will get to that towards the end. So let me turn it over now to my colleague, Ezekiel Massa, who is the head of LAC for diversity and inclusion here at SAP. Ezzy?
Thank you, Margot, and thank you to all people joining from around the globe. It's so good to be here today to commemorate World AIDS Day with this incredible panel that we have coming up. And before we talk about the impact that we've had across the regions at SAP and IBM and externally with some of the NGOs we're working with, I would like to invite two of our employees at IBM and SAP who have kindly been sharing their stories and testimonials of living with HIV. So we'd like to hear a bit from them to revisit their stories and hear how working positively has also impacted them personally. So I'd like to welcome Danny Barney from IBM, who's VP for Emerging Technology Engineering, and Carolina Pierri from SAP Brazil, who's Customer Evolution Partner here at SAP. So please welcome to you both. I think, Carol, you're going to start, right, with your story?
Yes, thank you, Izzy. Hello,
Thank you.
everyone. I'm very, very happy to participate today, celebrating the World AIDS Day event and the 5 years of the program Working Positively. This program has a huge impact on my life, and it changed the course of my story. I'm from Brazil, as Ezequiel has mentioned, and I have been working for SAP for 26 years. I'm married, and we have two beautiful daughters. I'm also considered as a long-term survivor since I have been living with HIV for 29 years. I developed AIDS at the end of 2001, but survived thanks to the free treatment provided by the public health system here in Brazil, which has ensured that I have been undetectable since 2002. When I received the positive result, my first reaction was shock. I was only 16 and still far from the starting of my adult life. I also received the doctor's suggestion. It's better don't tell anyone. It was the 90s, and we still saw many people dying of AIDS. The treatments were still in their early stages. The drugs were not very effective and had many side effects. So I decided to leave my story alone, not telling my parents, neither my friends. And now I remember these days as always feeling fear and guilty. And now I can understand that I developed a survival instinct, living one day at once, taking important decisions about myself when I was not even adult yet. Living the duality of trying to plan and see a future while living the expectation of death. The medical recommendation at the time was only start the treatment when a significant drop in the immunity appears. So I move on, finish high school with some difficult because I had co-infection, I had hepatitis. And next year I could start the university, and many years later I have joined SAP, started my career here, and made wonderful friends who are important in my life to this day. In 2001, the first opportunistic disease appeared, and the doctor recommendation was that I need to start the treatment right away, or there was nothing to be done. It wouldn't be possible to beat the infections that had started. It was a hard journey. The side effects of the medication and the symptoms of the infection were very bad, and I made a huge effort to not show them to others. After a year in 2002, I was completely recovered. I married my beloved husband Fabio, and in 2005, Rebecca, my oldest daughter, was born. In 2011, Rafaela arrived to complete the family. My two daughters are HIV negative, thanks to the treatment and care following during the pregnancy and the first year of their lives. My life was going on happily, but I felt like I was not being honest about myself with the people I was around, my family, my coworkers, and I constantly thought, will they still like me if they know the truth, if they know I'm HIV positive? In 2019, I learned about the Working Positively program through a video with a testimony of a SAP colleague. He told his story, and it really touched me deeply. I remember thinking that maybe one day I could talk openly too, because the world had changed a lot since 95. And also I had changed too. In 2021, when the program was launched in Latin America, and I was able to hear more stories, I was sure that I need to give my testimony so people who live hiding and in fear can know that they are not alone. During the program's launch event, I approached Ezequiel Massa, and we agreed to develop something together. So in December 2022, we celebrate World AIDS Day by publishing a video with my testimony and a lot of HIV information, which is so necessary to eliminate new cases and break the stigma. I receive a lot of love from people around the world. Many of them told me they are not aware of how medicine had advanced in recent years, and I was also able to welcome colleagues with similar stories. The program was a gateway to significant changes in my life, but the most important was my own acceptance, my recognition as a person living with HIV, but with so many other layers. I'm someone much more than HIV. I'm very, very grateful to the creators of the program, to the colleagues who went before me and had the courage to be who they are. Thank you very much.
Thank you, Carol. Thank you for sharing your story. It's always so beautiful to learn about you, and you know, there's always these new aspects that you bring to the conversation every time you tell your story, and it's so beautiful to hear it. And thank you very much for sharing. Danny, how about you? How has it been for you?
It's always a pleasure to share a stage with Carolina, and anybody who has not seen the video, I really encourage them to look at it. It's in the chat there. It's a very touching story. My story is similar in many ways. I'm here today because I'm an employee living with HIV. World AIDS Day is special for me because in 2001, World AIDS Day, 1st of December, I started my treatment program. So Carolina and I have 2001 in common there. My previous HIV test was in 1989. And one of the reasons why I think this program is so important is because I reflect on why did I not get tested until 1st of November 2001, but for those 12 years or whatever. And as Carolina said, you know, there was not much upside to being tested during those years. In the 90s, the treatments didn't exist for many of those years. The treatments were very harsh and difficult to follow. There were all sorts of stigmas that were very public about, you know, people were losing their jobs, and people were not able to get financial instruments. You couldn't get on the mortgage ladder, etc. And so for me, there was really very little upside to getting tested until I got ill. And of course, by the time I was tested and I started treatment, I was very ill. So just like Carolina, I left based on what current medical guidance would say, I left it too late to, and as a gauge of that, if people measure the strength of people's immune systems in terms of CD4 counts. So a healthy male would have between 700 and 1100 CD4 cells. When I was diagnosed, I had 3. So I was very poorly. And, you know, there was a really great possibility that I would die in the next few months if the treatment didn't work. Clearly, the treatment did work, and I'm happy to be here and to be sharing the stage with Carolina and to be healthy and sound now. But I think this stigma, this fear of stigma, is why this program is so important, because a very important reason why I didn't get tested, one component of that, apart from the fact that there wasn't much to do if you did turn out to be positive, was that I was afraid I would lose my job. And I've often said that there was no data from my previous employers that I would have lost my job. But the fact is that we just never talked about it. In all my, in my previous jobs during the 90s, none of my employers talked about the support that they had for HIV positive people, or whether they would have programs that would support people that needed to take time off for treatments and so on. as it turned out, when I was diagnosed, I had to disclose to my employer because I had to take time away from work in order to get treatment and so on. And I'm happy to say one of the reasons why I'm part of this program and so proudly part of this program is that I've been very well supported by IBM during my journey here. And I think that's really crucial because what gets talked about in organizations is what employees hear as important. And so for me, again, I saw the program Axel had started with SAP colleagues in Germany, and I was very pleased that I could be a face of the program and make it a real life experience, real lived experience for other IBMers and SAP people and other people who've joined the pledge since. So I'm also very proud and happy to be here and happy to share my experience. So thank you.
Thank you, Daniel. We're proud to have you here, and Carol and Axel, who I saw is on the in the audience too. It's so important to hear your stories, right? Your firsthand experiences with the topic and how this program has supported you along the way in whatever way, right? It's been there for you, and I think that's the beauty of it. So thank you both very much. Thank you, Carol. Thank you, Danny, for sharing your stories with us once again. We have a great panel coming up now with some of our NGO partners around the globe, and I'd like to introduce you to them. If we can, there we go with the slides, great. So we have Carmen Ryan from Fundación Huésped in Argentina, who's Director for Institutional Development. And I don't know if it's just me, but I stopped seeing the slide. Do you see it?
No, it's gone.
Okay. So Carmen from Fundación Huésped. We have also Mario Harper, Director for Health Action Alliance. And we have two representatives from Trabajando en Positivo, Raquel Sebastián, who is CSR lead, and Deva Fernandez Gonzalez, project manager for this organization in Spain. So thank you, all of you, for joining us in this panel. And I would like to get to know more about each of these organizations. So a question to all of you, Huésped, Health Action Alliance, Trabajando Positivo. You all have a long history of community engagement and support for individuals living with HIV and other sexually transmitted infections. So can you share a bit about your history and also why you decided to partner up with SAP and IBM for working positively? I know who wants to get started. Carmen, okay, I saw you tilt your head, so let's go with Carmen.
I was waiting for you to let us know who should go first.
You go.
Hi, Esther. Hi, Margot. Hi, everyone. My name is Carmen. I'm here in representation from Fundación Huésped. It's really, really nice, Carolina and Danny, to hear your stories. We are always touched when we hear you telling about your experience. Fundación Huésped is an organization that has been working for 35 years. We got our 35th birthday the past week. So we have been working for 35 years in Buenos Aires and Latin America, working with two main goals: to promote and develop the better science possible to improve treatments, but also to work with human rights to promote every space to be free from stigma and discrimination. And we do that because our founders, two of our founders, were Roberto Jauregui and Pedro Cano, a medical doctor working with people living with HIV in the 80s in Argentina, and one of his patients, a journalist, being one of the first openly HIV positive people from Buenos Aires, and really committed on addressing the serious impact stigma and discrimination had when there was no treatment, when there was treatment, and now that we have undetectable, as Carolina was saying. So when we started working at Fundación Huésped, as we developed our actions, we got once and again different people that came to our our offices or called to our toll-free number to ask us what to do because they got discriminated at work. Carolina's doctor's recommendation was a good one, not to tell anyone, because it was information that would harm people, that would build any kind of assumptions around it. So when we started working with people that got discriminated at workplaces, we had like two different lines of work to go. Like we had a lawyer that we would do a claim and would do different things. And we'd also promote to have an advocacy action with the company to talk about it, because what we had been seeing in different situations was that even though stigma and discrimination was really harmful, really painful for people, it was also based on the lack of knowledge. People weren't mean because they wanted, they were afraid, and they had really poor and really bad information. So sometimes when we went to the place and we spoke to the person, we got a better answer than with a claim, with an action, a legal action. So when SAP and IBM started this project, it was like amazing, because when Fundación Huésped goes to a company and tells them the top of the science information, they believe us, but they think we are a little biased because we are really committed in promoting stigma-free and discrimination-free spaces. But when they see that worldwide companies can step up, show this commitment, and agree with us that science says for a long time that living with HIV changes nothing, that no work is undoable, that there's no risk in any work for people living with HIV or not, that this information is private, but if you want to share it, it should be okay too, because we should build the safest space possible to work together, then people will hear us more. And it has been like that. We have been working for several years in Argentina and Latin America with Ezequiel and different people, and many companies have started hearing us a lot more. So we are glad to be part of Working Positively, or Labor Positivo, as we say it in Spanish.
Thank you, Carmen. Thank you for sharing those insights. And yeah, it's been great to partner with you and Huésped in this journey. Thank you for sharing a bit also of your history. Mario, would you share a bit about Health Action Alliance?
Yes, I'm happy to. Thank you for having me, Ezzy, Margot, and team. Danny, it's great to see you again on the heels of our annual meeting, of which you so eloquently shared your story there, and it was greatly appreciated. My name is Mario Harper, and I'm the director at the Health Action Alliance, and I lead our U.S. business action to end HIV. The Health Action Alliance is the United States' largest employer network, operating at that critical juncture of business and public health. So we serve to bridge those gaps between business and public health, identifying opportunities for employers to leverage their resources and infrastructure to drive workplace well-being initiatives and social impact campaigns. There's obviously some great co-founders in this space, and I just heard Carmen mention her co-founder. My co-founder happens to be a decade-long friend of mine who started this work in Russia and Kyiv, and he built the first HIV coalitions there, and has since built them in Asia and come back here and worked in the Clinton administration and the White House, but also for the Kaiser Family Foundation, continuing its work and being a foundational partner for the Walgreens Greater Than HIV campaign, which exists still today after decades-long work here in our country as well. We thread all of the work that we do with what's called the Edelman Trust Barometer. This Edelman Trust Barometer is an international survey asking employees who they trust most to provide them trustworthy healthcare information. And year over year, employees say that they trust their own employer more than any other partner, whether that's government, whether that's media, whether that's non-governmental organizations. And so that tells us that there's an incredible amount of trust that's buried in that relationship between employer and employee. And it's important that employers take advantage of that and provide quality information, quality resources, and most of all, quality healthcare for their employees. And so this Health Action Alliance has a number of different programs that we focus on in the workplace, including workplace mental health. We were actually started in the COVID-19 pandemic, where the CDC Foundation, the Beaumont Foundation, and others, the Ad Council here in the US, asked us to rally employers around getting people back to work, helping them determine effective vaccine policies and masking mandates, and making sure that everyone felt safe to return during the COVID-19 pandemic. From that, we were asked to, by PACHA, or the Presidential Advisory Council on HIV and AIDS, to build this business coalition. And we're so glad that SAP is now a member of this coalition, and we look forward to IBM joining this effort as well. But this business coalition asks employers to utilize their resources and infrastructure to help us end the domestic HIV epidemic here in the US. These employers do a number of things. They make any of 6 commitments, from a simple public commitment to this initiative, but they also educate their workers to help end HIV stigma. They provide comprehensive benefits that are inclusive of PrEP, or pre-exposure prophylaxis, including all of the labs and ancillary pieces of the puzzle that are required for someone to acquire and maintain PrEP. They also advocate for policies that accelerate access to HIV services. As we know here in the United States, that policy advocacy is a critical part of maintenance of funding and making sure that there's different testing modalities and things of that nature that can meet people where they are and help them acquire the services needed in a way that is meaningful to them and one that they will take up. They also commit to supporting local communities by volunteering and also by doing lunch and learns, but also thinking about how they can utilize their business model to innovate new technologies and new ways of distributing HIV services and information to communities. We have some great examples of that through partnerships like Walgreens and Uber, where they were delivering free medications. Delivering medications for free to individuals who lack transportation, or giving people free rides to the pharmacy. We have a number of different documented situations where our companies who provide a technology service were able to do push notifications and break click-through rates, benchmarks for click-through rates, disseminating HIV tests to communities who had never received HIV tests before, and some of the communities that are disproportionately impacted by HIV as well. And then they also provide financial support, either to this coalition so that we can continue to grow our reach, or to those community-based organizations that I mentioned before. We have a couple of different programs that we have launched through this coalition. One of them being industry working groups, where we think about specific roles or industries that can have a unique impact on HIV. Think about HR leaders and think about ERG groups, but also think about media and entertainment, where we are thinking of where Paramount Pictures is one of our members, and they're figuring out how we can recenter HIV positive, but also HIV possible characters in media and TV and film to help the destigmatization and the demystification efforts that we are implementing to make sure that everybody understands what HIV is and how to take care of themselves. And so we're really proud of that work. We also have launched another program that creates local chapters in markets that have high HIV prevalence, like Atlanta, like Houston, like Los Angeles, and thinking about how we can bridge the gap between the local epidemic and public health response and businesses in those communities who have a unique opportunity to leverage their influence and their business models to have an impact there. So really grateful to be here today. I'll just say quickly before I close that the Working Positively Pledge and the U.S. Business Action to End HIV have aligned missions that can create synergistic opportunities to amplify impact. And so we believe that by combining the strengths of both the Working Positively Pledge and the U.S. Business Action to End HIV, businesses can create more inclusive environments, they can drive systemic change, and can accelerate progress towards ending the HIV epidemic here.
Thank you, Mario. And yeah, that's great, great alignment between these two initiatives. And as you were saying, also echoing what Carmen said earlier, right? Visibility, I think, is key. in terms of the media representation, in terms of the education that we are sharing now with our employees. So I think all of these different avenues to share information with employees or anyone who's, because we also have external joiners now in this meeting. I think is really good to create this awareness and not be scared, right? Carmen said that there's so much fear around this topic. So we need to keep talking about it and take action. So thank you, Mario. And Deva, about Trabajando en Positivo, would you share a bit about your work and partnership with the SAP and IBM?
Yes, of course. First of all, hello everyone, and thank you SAP and IBM for inviting us in this space. We are very happy to attend these necessary spaces. And secondly, Danny, Carolina, thank you for your powerful and touching words. Well, Trabajando en Positivo is a network of 16 entities present in 8 districts, regions in Spain, in 8 districts. Since 2007, we have been working to promote equality at the working place for people with HIV and other marginalized groups. Our projects are aligned with the SDGs and are based on community participation, gender equality perspective, and human rights. We combine the support for people in situations of social exclusion to improve their employability with awareness and sensitization of the agents involved in the labor field, in the labor market. In 2014, we launched our project, Positivo RSC, where we support companies to strengthen their social commitment by incorporating good practice in relation to the HIV, and where the initiative Responsible Companies for HIV and AIDS in Spain is framed. This initiative is pioneer in Spain and it has several objectives. All of the objectives are based on the elimination of discrimination against people with HIV in the workplace and the promotion of human rights. It provides companies, entities, and organizations with tools so that they can contribute to the prevention of HIV and the reduction of the stigma. Joining our initiative includes the recognition by our NGO, special recognition in a form of a stamp. SAP has signed our initiative on April 2021, and IBM signed on March 2022. Both joined the group of companies and organizations that have received the recognition for being compromised with HIV. In 2022, the Working Positively program is brought to Spain. Trabajando en Positivo became the reference organization in Spain for companies to strengthen their social commitment with the incorporation of good practice in the field of CSR in relation to HIV. In October 2023, an event was held to set up the Global Alliance created through Working Positively program. This alliance means joining efforts at global level to advance in HIV response and is allowing new companies and entities to formalize their adhesion to our initiative in Spain to join the international Working Positively program too. And of course, also the large group of companies that since 2019 are already part of Working Positively and have delegations in Spain, they can join our initiative in Spain as well. Thank you.
Thank you, Deva. And it's great to hear all these perspectives from around the globe and how all of us have a great power in in creating all this awareness in our fields of influence, right? In this case, in SAP and IBM, and every other company who's joining this webinar at the moment. Deva, continuing with you, I would like to ask you if you see that there's a link between working positively and other topics under the diversity and inclusion scope.
Yes, of course. As we have mentioned through one of our most representative projects, en Positivo RSC, we support companies to improve their social commitment in the areas of human rights, diversity management, equality, non-discrimination, as well as in the area of social action. Through this project, we offer 3 ways of collaboration that take into account both diversity and inclusion. The first way of collaboration is our service of business prospection and intermediation for the work placement of people coming from social exclusion backgrounds. We offer a free pre-selection service that matches the company hiring necessities with the professionals' skills needed. The second way of collaboration is the initiative that we mentioned before, Empresas Responsables con el VIH y el SIDA en España, Responsible Companies for HIV and AIDS in Spain. This initiative involves fostering alliance and promoting the involvement of companies commit to diversity and inclusion, helping to end discrimination in the workplace based on HIV, gender expression, or sexual orientation. And the third line of collaboration through this project is the volunteering. Okay, it's an option for the company or entity to contribute through its own employees to deliver capacity trainings for the people that we support in order to improve their professional and personal skills and increase their chance to find a job. By other side, Trabajando en Positivo is the national reference on the creation of awareness on equality and not discrimination at the working place for people with HIV and other vulnerable groups. All our entities work coordinated in different directions and fields. The link we have with different international and national actors is influencing the achievement of legal changes. We are also members of the Diversity Charter, which commits us to promote the principles of equality, diversity, and inclusion in the workplace, and to promote respectful, inclusive, and safe workspace that value talent regardless the identity, sexual orientation, or gender expression. Finally, one of our most representative actions in relation with the diversity and inclusion is the awareness campaign Ruta Yo Trabajo Positivo. The 9th edition of the Ruta Yo Trabajo Positivo was launched in October this year, a few months ago, and it will run till December 10, Human Rights Day. In this campaign that aims to link society in general and more specifically agents involved in the labor market as trade unions, companies, public institutions, etc., we do it through simple messages. It's a very easy campaign through simple messages based on scientific evidence, which help to transform the view towards people with HIV and defend their rights. And this year we have focused on the sports centers, understood as a working place, linked to the importance of keeping healthy lifestyles. I think if you want to amplified information, there is a flyer share in the chat, so you can check a little bit more about our awareness campaign. Thank you so much.
Awesome. Thank you, Deva. And I think, yeah, Carol will upload the flyer there. And so it's really important to well, I would summarize this as working positively is a great avenue for us to create work environments that are free of discrimination, free of bias, that are inclusive, right? And this, of course, is very centric to what we work on, right, in diversity and inclusion, right? Our objective is to create more inclusive workplace cultures, and that's why we're here today, right? To create an environment that's physically and psychologically safe for our employees. So we have here Carol and Danny who are able to share their story, and the goal is not for other employees living with HIV to also come forward and share their own, right? Anyone can do whatever they feel like doing, but knowing that at SAP and at IBM, we will have their backs if they choose to. So I think that's the point of it, right? And about this, creation of an environment that's free of bias, I want to ask Carmen, what are the most typical misconceptions and stereotypes that we see around HIV in the workplace?
Thank you. It's such an interesting conversation so far, and it's really, really interesting hearing about other partners of working positively and how it works in different places of the world. I chose two biases, misguidance that we usually come up when we work with different companies. A few years ago in Argentina, we have like a general health checkup that we do when someone gets in a new job. Historically, it was an opportunity for discrimination because HIV would get tested there and people would not get the job. It was like on the process of coming into the work, and administrative processes would come up, changes. Well, it was an opportunity for discrimination. A few years ago, it got forbidden to include HIV testing in the process of getting a job in what we are calling these general checkups that should be an opportunity for the work environment to be a healthy space for all. And in those conversations and the conversations that have been coming up on the past 2 years with several companies, one of the things that comes up is that there are some positions that are not good for people living with HIV. And what we usually answer is there is no job that someone living with HIV can't do. None, not even one. And we do the exercise of them telling us which job you're thinking of. So we can go back step by step on how every job is a job that could be done for a person with HIV, because nothing of the work environment should be an exposure situation. And if you're thinking about medical situations and that kind of thing, then being HIV positive is something that can change every day. One of the things that we usually say is that a person can go through testing and be HIV negative and go celebrating and be careless that night, and then on the next day change their status. So having a test doesn't change the information that you have of one person. In order to be safe and careful, every practice that involves a possibility of transmission should be cared with prophylaxis mechanisms. That includes using gloves if you have to use gloves. That includes using a face mask if you have to do it. It includes not reusing any needles. It includes every measure that you have to take if you know the person that you're working with is HIV positive, and if you don't know, because you don't know. So that's one of the first misconceptions that we have. And the second one is that the person living with HIV, it's going to take time. It's going to have health difficulties? And I like to answer that with a scientific protocol that got released 2 years ago in the Dutchlands. They did a protocol like following up people living with HIV and people who were not living with HIV. And they got that people living with HIV on the past 15 years with access to good medications would have a life expectancy a little bit longer than people not living with HIV. And you're going to say, why? You're completely crazy, Carmen. What are you saying? No, actually, those persons would go on regular checkups, would stop smoking, would be careful on how much they drink, because they have really, really regular checkups to follow up their health. That's a thing that some women do, but many, many men don't do. So when you have many men on their 50s, on their 60s, and many women, then you're going to see that having employees that do regular checkups because they are following for a chronic treatment, then they're going to have a better health, actually. So there are 100 misconceptions we get. Every time we think we have them all, then another one comes up, and they are all beautiful, because the important about misconception is that people feel safe enough to tell them, so we can go through the science and give them an answer, because sometimes we feel like, oh no, maybe this is not such an intelligent thing to say, and the only thing that is not intelligent is to shut up and to keep the fear inside and not tell what you're thinking. So I hope I'm being clear. It's a day of too much Spanish speaking to do this English speaking.
No. But I think it's been very clear. Thank you, Carmen, for sharing. And Danny's not giving up drinking. He said it in the chat. So, and you know, out of the things you said, Carmen, I think it's important to reinforce that we don't need to know someone else's HIV status. I mean, there's no need for anyone to disclose whether they are living with HIV or not, right? It is completely confidential, right? And in the case here of Carol and Danny, they decided to share and come forward with their stories. But no one needs to ask you if you are living with HIV or not, and you don't have the obligation to tell anyone. I just wanted to reinforce that. And Mario, I know we've spoken earlier about Health Action Alliance and the work you're doing, and all the possibilities and potential that there is, joining Working Positively, bringing these initiatives closer together. But what do you see briefly as a possibility, right, to scale this partnership with Working Positively?
Yeah, first and foremost, I want to make sure we don't leave HRC out of this, because I think they were the connective tissue with bringing us together. But I think through our partnership with HRC, SAP, and IBM, the U.S. Business Action in HIV is creating a pathway for companies who join our coalition. I know we're creating a pathway for them to sign the pledge, the Working Positively pledge, as a part of one of our commitments, which is to publicly declare workplace support of HIV awareness, education, and resource deployment that helps end stigma and promote HIV services, not only internally on the job, but also externally in the communities where these companies have a footprint. I think making this pledge signals to the employees of these companies, to the industry peers, to community, and to the world that these organizations support advancing the requisite tools and infrastructure demands to help us reach the end of a 4 decades long epidemic that has taken more than 42 million lives globally. And here in America, it impacts more than 1.2 million Americans that we know of. As we think about what our opportunities are for expansion and going deeper, I've heard Carmen and others speak of some of the things that they're doing, and I think that's much of what some additional opportunities exist for this working relationship, including those joint awareness campaigns. We can embed some collaborative messaging to develop co-branded campaigns that highlight the importance of workplace inclusion for people living with HIV and the role that businesses can play in ending the epidemic. Obviously, leveraging the network, where we mobilize more than 100 companies through this coalition, and almost 70 of them are making concrete commitments. And using that visibility of the Working Positively Pledge, we can amplify those messages across a number of different industries and sectors. I think another thing that we can do is share best practices by use of case studies, where we can showcase the companies who are excelling in both initiatives, the Working Positively Pledge and U.S. Business Action to End HIV as models of success. And we can also, which we already do, create additional toolkits that can be distributed for ERG groups and HR teams that can integrate HIV inclusive workplace policies with broader health and well-being strategies that the organizations already own. I spoke earlier about policy advocacy. I think having a unified voice in advocacy goes a long way. And so having the ability for this initiative in the U.S. Business Action to End HIV to advocate for workplace and public policies that reduce stigma, support employees living with HIV, and improve access to prevention and care is critical. Co-hosting events like you guys have done today. We can organize briefings and roundtables to engage policymakers with participating companies, sharing the tangible benefits of inclusive HIV-related practices. I also think workforce training and education. Again, we have a number of resources, and I dropped into the chat earlier our impact report, which I hope you guys will check out. But hosting workshops and webinars is something that we do here at the Coalition, and it would be great to combine those efforts with the companies who have signed the Working Positively Pledge and be able to use that as stigma reduction opportunities and additional customized programs. It's really important for companies that are part of this that we recognize them and bring visibility to what they're doing. And so we have started just this year at our annual meeting an awards spotlight, right, where we celebrate the companies in both initiatives through awards or high-profile recognition at industry events. And then lastly, I think the community and employee engagement is critical. Having volunteerism and partnership opportunities that we can organize joint community impact projects to support local HIV service organizations. The business community is a missing piece, and we're a vehicle for making sure that we cover the gaps that exist. But there's so many great organizations, non-governmental organizations and community-based organizations that have been doing this work over the last 4 decades who are just, and the work that they do is so valuable and critical to making sure that we reach the communities and we are executing this work in a voice that sounds familiar to the communities that are impacted. And then ERG empowerment. I can't speak enough. I feel like many of the people on this call today are likely a part of some ERG or have the ability to join some ERG. I think, equipping these employee resource groups with programs that integrate Working Positively values into the broader health, wellness, and diversity initiatives within these organizations is so critical. So.
Yeah, awesome. Thank you, Mario. So yeah, lots of opportunities for collaboration, and a big shout out to our ENGs probably present in the chat, and to HRC also. I saw Carly in the chat, so thank you for mentioning the Human Rights Campaign, Mario. Margot, I think we have a few questions in the chat, right?
Yes, and thank you for a wonderful panel. We'll have some good closing remarks and next steps and actions that come. But I'm going to ask a few questions. And yes, when we talked about the history of the last 5 years, we certainly did shout out HRC at the beginning. And it's good to keep that well-rounded in how we're collaborating. So the first question talks about many companies and managers fear negative feedback regarding this topic. How prepared companies should be when starting with such a campaign in a region where Working Positively is not up and running at the moment? Is the question is, how prepared should they be when there's nothing there already? I mean, any one person can answer this, but I think a lot of what we covered today hopefully will be helpful.
I'm happy to.
Go ahead.
Yeah, I'm happy to jump in there. We've created a number of resources from sample HIV workplace policies to letters from company leadership that can be customizable, but can also be used as is to help organizations who are starting from ground zero understand how to implement strategies to address HIV in the workplace. And I think it all has to be done through a lens of learning and sensitivity. And so creating, leadership groups where there can be some brainstorming on how to make sure that there's a sensitive approach that's sensitive enough to disseminate or deploy within the employee base, but also calling on leaders from ERG groups, right? who represent these communities that are disproportionately impacted, so that they can make sure that there are brave spaces and that the information that's being given out is going to be received with the right in the right tone. So.
And those are good points. I think normalizing it and making it a part of your wellness, your health and wellness programs and plans and benefits, that just like you would for any other condition or illness. Thank you for that. Another question that came up, and I'm going to just jump to the question that's in it, but they're complimenting that it's been a great session and very inspiring. And it says, how and when should one disclose their HIV status to the company they work? You don't have to, as was mentioned before. Very privately, very inclusively, and such would be one of the suggestions. But if anybody wants to talk about the how and when to disclose it, in their experience, it is a challenge due to the stigma, lack of education. Also, criminalization is still a thing that needs to be addressed to help reduce the stigma and fear. And so can working with your company, public policy, help? So those are two questions there: how and when to disclose, and can working with the public policy help? I know we're short on time, but if there's a new answer of something that we can give here.
Yeah, very briefly so that we can wrap up with the closing remarks. Maybe Carmen, go ahead.
Maybe the first thing is how and when, only when you really feel the need to. And how? Always counting with support. A peer support and mental health specialist support and NGO support. So you can talk to someone about why you're feeling the need to share that information that is private, that is not necessary for anyone, and that you want to share. So in the cases of Dani and Carolina, they probably had their personal experiences about how and why they decided to do it, but don't do it alone. It would be my first recommendation. You don't have to. It's not your obligation. You're never have to feel forced to do it. And the only thing you need to take care of is that you really want to do it, and why, and with whom, and the certainty that this information is going to be well cared of. And with that in mind, if you feel the need to, if you feel like the pull to, because you want to share this information because you believe that something good's going to come up and you have someone to support you on the way to do it, then as you please, because you're supposed to be protected. You're supposed to be safe. If you're in a country where criminalization is an issue, then you should be especially careful. It's an issue in several countries. It's beginning to be an issue in Argentina, for example, that wasn't an issue for many years. So you need to talk to your civil society organization that is closer by to think about what is the situation there where you're living, and how and where you're going to share your information. So we need to all work together to stop criminalization. It doesn't help anyone's health. It's actually something that is harming us in the possibility of moving forward to reach our goals for 2030. So, but while we do it, then we need to take care of ourselves.
Thank you, Carmen. And thank you, Mario and Deva and Raquel for your participation in this panel. It's been great to hear about your experience and perspectives around the globe. And before we wrap up, we have some closing remarks with Michael Herning from IBM.
Yeah, and so we're right on top of the hour. Thank you so much. Thank you so much for all the participants joining here globally for this important call today. Thank you so much to all the speakers, the NGOs joining today, Fundación Respet, Health Action Alliance, Trabajando, and Positivo. Can't thank you enough for being on the panel. Before we close this call, I have 3 calls to action. Join Working Positively today, wherever you are on the globe, if you've not already done so. Sign the pledge with your local NGO, like the ones who were on the panel, or others, like the German AIDS Foundation, who was the founding father of Working Positively, or not so well-known ones like Checkpoint in Sofia, or Let's Stop AIDS from Canada, who's one of the latest NGOs who joined this initiative. And Last but not least, use your internal employee communication, such as onboarding or employee calls, to stop the stigma. So whatever you do, be sure to fight the stigma against HIV in the workplace every day, and not only on World AIDS Day. So let's get together again next year and double the signee numbers. Until then, feel free to reach out to us or the local NGOs you work with. And thanks again to everyone joining this call.
Thanks, everyone.
Thank you, Michael. Thank you, everyone.
Thank you.
Appreciate it.
Have a good week.
Have a great week.
Thank you very much. Thank you. Bye.
Thank you. Thank you very much.
Thanks, guys. See ya.